I actually got a Bimax jaw surgery. That's where they cut your bone on the maxilla and the mandible and they reposition it to make you look more attractive, and also it fixes a lot of things like your bite and potentially sleep apnea and a couple of other things. If you don't believe me, this is a metal detector. And if you put it on someone's face, it's not supposed to go off. But because I have titanium plates on my bones, it's going to go off. There you go. Okay, so would I do it again? Yes, I would. It was about $60,000 out of pocket. Insurance is not going to cover something like this because they deem it cosmetic and not important or not crucial. And even if you were able to find a way for insurance to cover this, you're going to be paying out of pocket anywhere from $5,000 to $20,000, depending on where you live in the world and which doctor and hospital you go to. The most important thing you need to know about this is that the recovery is brutal. I had braces for 2.5 years before this surgery. It is something that I researched religiously. I did my homework, and I came to the conclusion that it was worth the risk, and I still live with the consequences. My lower lip right here is numb, as if I were coming out of a dentist's office after getting a filling from a cavity, and that's never going to go away. Some people never regain their feeling because when the doctor is opening you up on the surgery table, my surgery was like 6.5 hours long, they're literally taking your face apart inside. Don't picture it if you don't want to. It's a little crazy, but it's the truth. And so when they do that, the nerves get all moved around inside your face and they get stretched. And what happens is that you lose feeling. I lost feeling from my eyelids down to the bottom of my chin. And I didn't regain most of that for about 3 weeks, 4 weeks, sometimes a little bit longer, or a little bit longer with certain areas of my face. And I never regained full feeling in my lower lip and my lower left chin right here. And so it doesn't look like I don't have feeling, and I have enough to, live life without noticing it too much, but it is something that I'll have to deal with for the rest of my life. I had to eat and drink through a syringe for 2 months, no solid foods, couldn't chew. My mouth was wired shut for 3 weeks, and I lost 20 pounds in the first week. And so it's a very brutal surgery. I wasn't able to work. I work from home. I have a home office, okay? Like, this super easy job on the body, right? I could not look at a screen for 3 weeks. And so it's a very big financial commitment on the surgery side, but also if you have a job where you're like important or